Hello, my name is Sumeet Asrani, and I'm a hepatologist at Baylor University Medical Center in Dallas, Texas. I appreciate this opportunity to discuss our research on the role of magnetic resonance elastography in persons with compensated and decompensated cirrhosis. Now, it's known that persons with compensated disease and decompensated disease have disparate clinical outcomes. For example, somebody with compensated cirrhosis has about a five-fold increased risk in mortality as compared to the general population, whereas somebody with decompensated cirrhosis has about a tenfold increased risk in mortality. So identifying persons who transition from compensated to decompensated cirrhosis is important, yet imperfect. So far, hepatic venous pressure gradient is a mechanism to identify this transition. However, hepatic venous pressure gradient, or HVPG, is invasive and not readily available. Hence, there has been interest in looking at non-invasive predictors of this transition from compensated to decompensated liver disease. Now, ultrasound as well as MR-based elastography has been associated with presence of cirrhosis as well as identification of clinically significant portal hypertension at baseline. However, its role in predicting decompensation has not been evaluated. In this study, we examined the role of MR elastography for two purposes. One, to see if it can identify persons with decompensated cirrhosis at baseline, and two, to see if it can identify persons with compensated cirrhosis who are at risk of proceeding to decompensated cirrhosis. Between 2007 and 2011, we examined all persons who underwent MR elastography at Mayo Clinic Rochester and followed them through September of 2012. During this time, we included all persons with either biopsy-proven cirrhosis or clinical evidence of cirrhosis. We comprised a baseline cohort as well as a follow-up cohort. The primary variable of interest was liver stiffness measurement, as quantified by MR elastography, and the primary outcome of interest was presence of decompensation, whether this is variceal bleeding, ascites, or development of hepatic encephalopathy. First, looking at the baseline cohort. We had approximately 430 subjects with cirrhosis. Of these, about one-third had evidence of decompensation. In this study, for persons who underwent MRE, persons with decompensated cirrhosis had a higher liver stiffness value of 6.8 kilopascals as compared to persons with compensated cirrhosis, which was about 5.2 kilopascals. On multivariable analysis, liver stiffness measurement as measured by MRE was significantly associated with hepatic decompensation with an odds ratio of 1.12. We subsequently broke this into four quartiles of MELD and liver stiffness measurement. Persons with a MELD score less than 10, as well as a liver stiffness measurement less than 5.2 kilopascals, the prevalence of decompensated cirrhosis was 16%, as compared to in the group with the MELD greater than 10 and measurement of liver stiffness greater than 5.2 kilopascals, it was about 68%. Next, we looked at a follow-up cohort. We examined all persons with biopsy-proven advanced fibrosis stage 3 or 4 who had compensated disease and followed them for 27 months. Over this time, 7% of patients had decompensation. Once again, liver stiffness measurement was a predictor of development of decompensation. As an example, and using a cutoff of 5.8 kilopascals, persons with compensated disease at baseline and a liver stiffness measurement greater than 5.8 kilopascals had a five-fold increased risk of decompensation as someone compared to having lower values than that. Now, the question becomes is whether MR elastography is similar to ultrasound-based elastography. It is unclear whether they have the same predictive values. However, in a recent meta-analysis by our group, ultrasound-based elastography as well as MR-based elastography both equally predicted the rates of decompensation, development of hepatocellular carcinoma, as well as death. Now, the pros of using MR elastography is that it is easy to add to an MRI examination. There's a higher rate of completion, as well as it can be easily performed in persons that are obese, as well as those who have evidence of ascites. With ultrasound-based elastography, it is more easily available. However, it does have a high rate of incomplete examinations. Finally, in our study, we were not able to compare hepatic venous pressure gradient measurements, as well as MR elastography in a significant number of people to reach a valuable conclusion. So in summary, MR elastography is a novel tool to assist in the management of persons with liver disease. With this study as well as other studies, I think elastography has moved to a realm where it is no longer just a diagnostic tool to diagnose cirrhosis. However, it can also serve as a prognostic tool to identify persons highest at risk of complication and therefore needing further follow-up. Thank you.